serving and empowering nurses. This is Nurse Connect with Kristine.
Hello, good morning, everyone. And Esther, how are you?
Hi, I'm good,
Thank
thank
you
you.
so much for coming in today and having the share your experience to our community of nurses that are waiting to hear from you. Okay,
Yeah.
experience as a coronary care unit registered nurse, and so our podcast viewers are very excited to hear from you. We're gonna have a informative session, I believe, because these are much requested, of course, by the nurses. And we've got a beautiful mom here, Esther, who has got a beautiful daughter, of course, right? And I've known Esther. She's very kind and respectful. And I'm very proud of you, Esther, for what you've achieved, right?
Thank
And
you.
because she messaged me and she messaged me directly and said, "Oh, Miss Christine, I've got this role in the nursing home." And I was like, what? That was quite fast, right? And why am I proud of you? Because usually it only get offered, to those that are the one that is, qualified, either qualified for it, have a great character, or see the leadership in you.
Yeah.
Okay, and so I was very proud of you when you said that to me, and I thought, I'm sure you're gonna give a lot of insight to our nurses. And so Esther has been a registered nurse for many years now. How many years now, Esther?
Something about 6 years now.
Wow, yeah, that's a lot of years of experience to share today. And she's also been working in the nursing home as well as now get offered a job in CCU. Okay, so station nurses, for those of you as well who wanted to, progress, because Esther, we're going to get a tip from her how she gets there also, because that's part of our questions. But thank you again so much, Esther. I'm sure the community of nurses will be happy to hear from you. And so let's dig in straight away to our question, all right? So the first question for you, Esther, is, are you enjoying your work in general so far as a registered nurse?
Yeah. So far, um, what I've been working toward too, and what I got, I was pretty satisfied with it.
Oh, so good. It's the same as me. I still enjoy it. As you know, I still teach nurses. And so, you probably wanted to be in that area. Let me know. I can help you. But it's always good to serve the community, right? And with you were a clinical manager before care coordinator, moved to a quality compliance officer, and now a CCU nurse, right?
Yes.
Are you able to compare that work, Esther, and what do you enjoy most?
Yeah, sure. So, first started when I was so after I finished my OSCE and then got my RN registration. So the first 2 months was the training and body shift on the floor with the other nurses. So after 2 months, I got a call from my manager to see we got the clinical manager role that she need to move to other facility to help out their facilities, and the priority of the role need to step up, and no one want to take the clinical manager role, and she said, oh, you're the last resource expecting the phone call from me. And I say, I don't know what would be involved, but I will give it a go. Yeah, so I started from there. I was doing it for a while, and they were asking, do you want to take it permanently? And for me, I was thinking of just doing my RN, just the first year Australian RN, but I want to see the other different area of nursing before I say yes. So I say I can do it short time to cover until you get someone out permanently, or either if anyone want to go on the leave, annual leave, something, so I can cover that short time. But permanently, I probably will say no first. Yeah,
Mm-hmm.
so after I do it for a while until they got someone permanently, and I shifted to the other role, which is quality support compliance officers. Yeah.
Mm. And so, what do you like? What do you like most? The compliance officer, the the
Uh,
manager, or the CCU as a CCU nurse?
I think I like the CCU the most because my my passion is about the clinical side, but I still wanted, to learn and working on what I learned about when I was doing the clinical manager was the leadership and management skills, which is I got little before, but after that, once you get in the role, you was train you and send you off to this conference, this training, so you had a chance to make the connection with the others, like the manager side from different facilities when you went to the trainings, which
Yeah.
is a good connections.
Yes, yes. So you can't really, because every experience for me as well, Esther, I believe, it always brings something, right? And
Yeah, yeah,
so I think we're the same in that way, you know what I mean? Because I'm very proud of you because you tried to explore things and you really wanted to land where you wanted. And I'm happy that you did say, you like CCU best, right?
yeah,
Yes, because later on you will be an indispensable nurse, having to have that, critical care experience. Now, the second question, Rester, is what does a registered nurse at CCU full shift looks like? Are you able to walk through the listeners at this moment, break down briefly the task for them?
yeah. So for the CCU, so I'm still trying to refreshing back. So with my ICU background and switching back to the CCU specifically. So with the first 2 weeks when I started, fortunately, they have with the hospital they have the CNE, the clinical nurse educator. So they got two CNEs, so cover the whole week. So you'll be with that 2 weeks, you'll be like one on one with the CNEs, which is pretty good. Yeah, so
So
after the 2 weeks pass, they will check with you again if any area that you not feel confidence or you want extend your weeks of supervisors. And yeah, after 2 weeks, so I be on my own after 2 weeks, and of course I still got my in charge if anything I'm not sure, and I can ask them. Yeah, so the after the 2 weeks, and I'll be doing on my own. I think with this CCU, it's a coronary care, but it's covered the whole things
yeah.
with the heart, either the chamber itself, the valve, or the um, or other coronaries branches.
Mhm.
Yeah, so with the CCU in the hospital that I work with is a private hospital, so they is a major heart surgery. So most of the patient will come from the theater.
Yeah.
So it's a quick recovery. So it's quite different from the ICU, but that I came from the ICU that I came from is medical ICU. So the patient will stay a lot longer.
A
Here
lot.
it's just short, quick turn. The
Yeah.
patient came in the next day. They off the ET tube, off the drain, and then send off to ward or either go home.
Mm.
Yeah,
Yes, I just wanted to let everyone, because I work for CCU as well myself, Aster, at
yeah,
Northern Beaches Hospital, and it's for those of you listening, it's a special care unit, of course, and yeah, you're right about that. They stay and then they go. And would you work in ICU? Is that your target later on, or not really?
not really. So I tried to dig in different area of nursing to see what else I haven't tried. I didn't know all about it. Yeah.
Mm-hmm. And what do you like? What do you like about working at CCU?
What I like it, I think it's about um. So back home, I think that's the old practice where the patient stay in bed most of the time and they will mostly sedated. But here is the quick. relieving of the sedative, and the patient is more fully involved in the care
Yeah.
and quick recovery. Yeah, so you'll be able to like involve the patient, talking to them, and yeah, late night conversation is always makes something different.
Yes, I guess for me as well, I like, talking. That's why I started this podcast, right? You're right about that because you wanted to, develop rapport as well with your patient and get to know them. They always have value as well, right? To
Yeah, and
give
yeah,
back. Mm,
the other thing I like to explain is, I think back home was back then we still doing physical restraint and not really see it here. They mostly
mm.
little of chemical restraint, but people are freely to go and do like mobility fully ambulate. Yeah,
Because the main, I guess, as a holistic care, right? Get them back to where or what their previous ADLs like, right? And so in Australia as well, it's more of like a holistic approach instead of like a family, family support approach. You know what I mean?
yeah, yeah,
Right? So we're involving the mobilizing all the healthcare team. And I guess it's best that way because it's not limited to funds, if you know what I mean, Esther.
yeah,
It's like back home as well, like every single test, procedure, referral, it has to be consented.
yeah,
But here, whatever is best for the client, we organize it, we mobilize it. And I believe, that help also the nurses to really look after the patient holistically, refer if you have to, and collaborate accordingly, right?
yeah,
That's a great thing about when you were starting. I love when you say, you had the support, right? And I
yeah,
thank God that there's still support like that because, some hospital that don't even provide that support now,
mm,
like a 1 week supervision, say, for example, right? So I'm really happy that you did have that
yeah.
and being able to love what you do now. So really happy about that. With the CCU pay, Esther, are you happy with your pay? I have to
Yeah,
ask
yeah,
this because this is where a lot of the nurses ask questions. You know what I mean? Because also I believe that we should get be paid. You know, we need to get paid. What do you call it? Deserving of what we do, isn't it, Esther?
yeah, yeah. So it's more
Because
complex.
yeah, it's especially if it's a specialty unit,
Yeah,
right? That's why I wanted to ask: do you get paid extra working in a CCU?
no.
Yeah, yeah. So I think that's what we're gonna need to push for, right? Because if you work in an agency, though, just for the nurses' community awareness, when I work for an agency, whenever we work for a specialty care unit, we get $10 per hour extra.
Mm,
Yeah, and I guess that's different in every agency as well. But when I work for Healthcare Australia, big agencies, they do offer like $10 on top per hour per shift if it's a special care unit. And so the other question, Aster, I thought I lost you there, but what advice can you give the nurses out there in terms of wanting to be a CCU nurse?
Uh, I would say, yeah. For me, it was really hard to shifting from the aged care to the CCU,
Exactly.
because the period of time that I wasn't in the acute care. But yeah, keep applying, and then yeah, eventually the opportunity will come and knock on your door.
Yeah, it's
Yeah,
usually that's why I was so proud of you, Aster, because usually CCU is hard to get into, right?
yeah, yeah,
Especially you don't have that background here. And so I guess like Aster, like me, I'm just like, if I want it, I get it. You know what I mean? I want it to be where I am, so I do whatever I can, right?
yeah.
And it was such a shame because some nurses I spoke to, a nurse, gave her I gave her a work and she didn't really follow up. So you know what I mean. So we gotta need to follow up, nurses, if there's something that we want. Okay. And the last one, what's your long-term goal as a nurse, Esther?
I'm probably
Apart from
trying to.
raising your beautiful daughter that we heard in the background. So cute.
We're probably trying to work on the other area of nursing to see what else that I want to try and see how I go. Want to looking at the peri-op, maybe theater or recovery. I haven't tried that yet. I don't know. Yeah.
Yeah. I'm excited for you, Esther. And again, thank you so much for sharing your insights for the nurses. And I believe we've helped them. And you know, she wake up early for this, and I'm so happy that we had the time together. I'll catch up with you soon, Esther.
Okay.
Okay? Yeah. Thank you so much, nurses, for your time and for listening today. I do hope you stay tuned for the rest of this interview with Aster. If you do have any questions at all, please comment on the comment box. Send us an email. You can follow me, Nurse Teacher Kristine Australia. For those of you wanting to hear more and wanting to know more about the interview information, just send us a message. Okay. Again, thank you so much, Aster, and I'm so happy to see you today.
See ya.